Okay, we call the meeting of the Waupaca County Health and Human Service Department Board to order for this Wednesday, November 4th. Due to the COVID-19, this meeting is conducted under the Waupaca County Resolution Number 8, 2020 to 2021, and Governor Evers Emergency Order Number 1. The meeting will be broadcast for remote access on a live stream at YouTube. The call letters are there. This meeting may inadvertently cause a quorum of other county committees or of the County Board of Supervisors. No business decisions of any other committees or the Board of Supervisors will be conducted at this meeting. Participation in person is permitted. This meeting will be conducted using CDC and DHS guidance regarding social distancing. Tables and chairs will be arranged accordingly. Face coverings are required unless an exception applies. In the attendance sheet, I will circulate around this meeting, and all other meetings of this committee are open to the public. Proper notice has been posted and given to the media in accordance with Wisconsin statutes, so that the citizenry may be aware of the time, place, and agenda. As I said, the roll call sheet is passing around. We have an agenda in front of us. Is there a motion to approve the agenda as written? Moved by Jan. Is there a second? And that's by Sue. Those in favor of the agenda signify by saying aye. Aye. Opposed, and it has been approved. Minutes of the previous meeting of October 7th have been made available to you if you've had a chance to look at them. And, Sue?
I have one correction on it.
Okay.
On number 5, the board member report, it says Sue attended the Wisconsin County Seminar on Cybersecurity. It's Sue attended via Zoom. Just add via Zoom.
Yeah, okay.
Okay, thank you.
Thank you for bringing it to our attention.
Craig moves to approve the minutes.
And moved by Pat to approve the minutes as written with that change of via Zoom. Is there a second to that? A second by Dennis. Any discussion? Those in favor of the amended minutes signify by saying aye.
Aye.
Okay. They have been approved with the via Zoom change on there. Public comment. Seeing and hearing none, we'll move on to general board business. The public health COVID-19 update by Kevin.
So I'll start with just kind of going over our numbers, and I got the dashboard up here, kind of our current status. So we're at over 2,800 positive total confirmed cases, 51 today. I'd say this it's been 5 weeks now of basically a sustained surge of cases. October has been extremely busy for us, just like it has been for our region, the Northeast region of Wisconsin, and for the state. It looks like, we've basically plateaued. There's some fluctuations up and down, but on a week by week basis, we've been fairly consistent. It's just that it's been a really high level, around between 300 and 350. And that level caused us to not be able to do contact tracing like we had been before, where we were able to get a hold of every positive and then get a hold of every one of their contacts and go over full interviews and investigations with all those individuals. So it's been, I think maybe we're in our 5th week now of what's called crisis standards, and we are only contacting positive cases and interviewing positive confirmed cases, and maybe some limited contacts if it's someone involved with long-term care or health care or school-aged or college-aged. You might do some limited contact tracing there, but for the most part, we're asking people to contact their own close contacts on their own. And we're not alone in that. Every county in our region is doing some form of that. Some are doing even more of a crisis standards where they really have to prioritize who they're able to contact. And maybe they're still even behind on getting a hold of folks within 24 hours. We're still holding the line on that. Every day right now we're averaging about 48 cases a day, new cases a day, and we're getting a hold of everybody within 24 hours. So that's still been effective. We're still trying to, work with everybody who's confirmed, go over an interview, go over their health care, and talk about isolation and what that means, and then get them information for their contacts, and then for their employers and everything else, we'll provide letters with isolation dates, so they have those to provide to their employers. So we're still doing that. I'll say this: it's a very full day for us every day. I'll just go over where we have for staff again. So right now, of our 16 full-time employees, we have 10 of them basically are working full-time disease investigation with COVID-19. We have another 10 LTEs, basically 8 of those are basically full-time COVID-19 investigators. We have some that are also doing WEDS work, and then we have some that are just helping us on our backlog of other communicable diseases. We have some retired nurses that are helping us on that level. So, overall we have 21 staff that are just dedicated to COVID-19. And we're still just barely keeping up with the workload. But couldn't say enough about the group that we have. They work every day, 7 days a week. And they've really embraced the workload and done a really, really great job. Like I said, some counties are even in a different position than we are. So that's kind of the workload on the cases. Some other things I kind of want to highlight here. Yeah.
Are those cases generally young people or old people?
I can give you some of the demographics right here. These are, here's age groups, and this gets updated weekly. This is our highest age group, which are our 50-year-olds. And then I believe next are our 40-year-olds. 20-year-olds at one point, maybe a month ago, were leading with the number of cases. But since then, it's gone back to the kind of the middle age groups, the 50s, 60s, 40s, and 30s. So we're seeing it across the board as far as, cases right now of age groups. This is our hospitalizations. One thing to look at this is just daily hospitalizations. So what you want to see is this flat line. That means there hasn't been new hospitalizations for a sustained period. And we've obviously seen a steady climb every single day. There's new hospitalizations. Now this is a cumulative, so this is a total that we've had, 145. That's not how many we have right now. That's the total overall. But you can see the last month here, how every day basically there's a change in hospitalizations. The other thing I wanted to talk about was fatalities. So what you'll hear and what you see is when you have a lot of cases, you kind of have the surge and you have all the cases, and then behind that, you'll have the hospitalizations, which we're definitely experiencing in our area. Our hospitals are still reporting near capacity for beds, 90% capacity to full capacity. And then behind that is usually when the deaths will lay 4 to 6 weeks behind. And we certainly experienced that with fatalities. So we're up to 67. When I put some numbers together earlier today, this was going off of yesterday's total of 64, but 40 of those 64 deaths were just in October. So this month in particular, 40 of those 64 deaths were just in October. So the last 30 days, we have experienced quite a few fatalities. I can tell you, so of those 64 that were reported yesterday, 48 of them were long-term care residents. The rest 16 were not long-term care residents. So Certainly affects our long-term care facilities. All of our long-term care facilities right now are in the middle of it. They're being affected by it, and they're working to do the best they can to mitigate on every level that they can. So that's some of the updated numbers and cases of kind of where we're at, and the surge that we've seen has definitely affected our numbers and our cases and affected our community. A couple of the numbers I'll share with you too. So every week I meet with the superintendents, school superintendents, and we look at trends to see where things are just going community-wide and what they're seeing in the schools. I'll tell you some of our trends that we're seeing in the community. So our 14-day trend is, our 14-day total of new cases is 674 total cases in 2 weeks. That's 48 cases per day. And then when you look at rate, which a lot of the metrics use a rate by population, by per 100,000, that puts us at 1,322 cases per 100,000, which is why we're in the top 3 in the country for states, because of the rate that we're experiencing right now. And the interesting thing about this too is when you talk about rates, I mentioned 5 or 6 weeks at a sustained level, is that it's been such a long sustained level. Now, even in New York, when they went through their surge, they experienced some really high numbers, some really high rates. Our surge, our surge is even lasting longer than what they had basically. We've kind of plateaued, but we're just still at that same high level. So we really need this to turn around and start, start trending downward to help us with our community spread and to really to help protect the long-term care facilities and everybody else that's out there that's vulnerable. Because community spreads what leads to it getting into some of the places that we definitely don't want it to get into. A few other things to, also our 7-day trend, it's right on pace with our 14. It's 324 cases, 46 per day, 635 per 100,000 for 7 days. A few of the things that we've continued to do in our response, as I mentioned, contact tracing with positive cases. We're working daily with long-term care, health care, schools, employers. Every day we're on phone calls with those folks. I have routine meetings, like I mentioned, weekly with the school superintendents, weekly meetings with the city administrators, routine meetings with long-term health, employers. We're constantly working with everybody in the community to do everything we can to mitigate and make sure we're communicating situation and status updates and things that we can do to help them. I'm also basically almost every day communicating with Wisconsin Department of Health Services. So we have, I have meetings with them 4 days a week. Health officers have meetings with their response group 4 days a week. So we're constantly talking with the state, talking about what we're doing locally and what the state is putting in place as far as any of their mandates, but also all the guidelines and all the pieces to the response. So it's a constant. This continues to evolve at a super fast pace. It has from the beginning and it continues to. So we're still learning things about the virus. We're still adjusting to some of those things, but we're also adjusting to just the absolute workload that we've had to endure for 8 or 9 months, and trying to forecast what we can manage now and what we can do in the future too. So it's pretty much continues to be an ongoing, evolving situation. Like I said, we've learned quite a bit and we've adjusted as we need to. I think we've done a lot of really, good things put in place as much as we can. We're still just, I don't know, we still have some work to do to get things to slow down a little bit. One other quick update too on testing. So we continue to have our weekly site. The National Guard manages our site, runs our site, our operations at the fairgrounds weekly. Every Wednesday, we have 300 tests available. We've had it for 3 weeks now on the weekly rotation, and we've had between 240 and 260 each time come through for tests. So people are definitely using it. as a resource, so that's been good. Today, I don't know what we had. I just got a text. Today, we had 176 tests done at the site today, so still being used. There's a lot more testing in the community too, which is good, because we need that testing to be able to identify those positive cases and do our investigations and get people in isolation. The other last bit is the vaccine. We are working on preparing ourselves for that. Still don't have a date or a timeline when some of that's going to start coming through. We're still hearing kind of mid-November-ish. So we are working on plans for drive-through when we get to the community, when we have enough vaccine to provide to the community, which may be, that's going to be more in the spring. But we're also working on plans for like closed pod vaccination. So when the state and the federal government identify some of the priority populations to get the vaccine to, we may be helping distribute those in those closed pod type of formats. We have a couple pieces to do. We got to register as a vaccine provider, just like everybody else. And then we have to kind of prepare for and plan for providing those. So we've been working on that for the last 2 weeks. And I expect sometime maybe at the end of the year, we'll be involved in that. Some of those first available vaccines are going to probably go to, like healthcare, make sure healthcare workers are vaccinated, long-term care, that healthcare is included, long-term care is included in healthcare. So I'll probably start with some of those type of populations, and then we'll get to some of the other maybe critical infrastructure populations. And then eventually, hopefully we get to a volume where we can do some community vaccination as well. So that's on the horizon, and that's something we're preparing for as well. So just, I guess, kind of a summary of where we're at right now with the response. Yes.
Good. Question, and you might not be able to answer it. With the winter months coming and we have our furnaces on and we don't really put in our venting and so forth, and the bug can last for a little bit, are you going to see more cases because we're isolated in the house?
Well, you might have more cases of people just being inside and not having the outside quite as available. That's all going to depend on who you let in your house. I mean, are you going to have gatherings in your house where folks are in close contact with each other? I think that's probably the determining thing there, whether you're inside. Are you going to go to indoor events? That's going to be a place that's going to have a higher risk of getting the virus.
Jed, along the lines of what Janet said, I was approached by a lady at the grocery store a couple of days ago that knew I had some relationship to Health and Human Services. And she's asked me this: with the continuing growth of knowledge about this particular virus, are they finding that there is less viability of the virus on surfaces than they thought there was?
Yeah, I think by far the way, the means that this spreads is mostly through contact with other individuals. It's person to person, airborne. It's not quite as much contact surfaces. I think there's still that possibility, but that's a much lower risk from.
Because I didn't have an answer for her.
Yeah. I think the biggest thing to remember is that it's that person to person.
The other thing is, would you tell the people here again the times that they're doing it down in Fairgrounds?
The times? So
Yeah.
it's every Wednesday, 9 to 5.
Okay.
Now, Veterans Day is coming up, and is that next week? Right? Next week. So they will not be, we won't have it on Veterans Day. But then every other Wednesday through December, through the, I'd have to look at the last one, but through like December 10th is the last, is how the length that the National Guard is available. So that's what we have on schedule right now. Hopefully National Guard gets extended, but right now we don't know that yet.
Any other, Sue?
I had this question asked to me. When you count those deaths to 67, if they die like at Deer Park, is that coded for Winnebago or is it coded as Waupaca County if they're from Waupaca County?
It's wherever their residence is at the time. So let's say they're a resident at one of the long-term care facilities here, it's that address. If it's at their home in Waupaca County, it's that address. So it's got to be wherever their residence is listed.
Okay, thank you.
Anything else for Jed? Well, Jed, I just want to say something you've heard over and over again and should have heard over and over again. You and your staff are doing a tremendous job monitoring the best you can this unusual set of circumstances that we're all living under. And that I just want to thank you for your efforts.
Well, thank you. I want to thank everybody here for their support too.
Okay. Okay, moving on. We have a program presentation, Crisis Services by Heather Van Coy. Heather?
I've asked Heather to give us a little brief update on our crisis services. This particular area is one point of tension from time to time between the Department of Health and Human Services and law enforcement. And it's, nothing new. It's been, those kind of tensions been around since some laws have changed a few years back, and even before that. So Heather is, she's phenomenal at her job as well. And, we just asked her to give us a few minutes.
Heather, if you'd like to come up here, then some of us old people like me can hear you.
All right. So again, I'm Heather Van Coy. I have been employed here with Human Services for 19 years. 16 of those I have worked in mental health, and the most recent, in those entire 16, I've done the on-call working with crisis. The last 7 years, I've exclusively done that. So, been here through some of those changes, both in how we do crisis and the changes in the laws of how those are handled, whether that's with law enforcement or, our hospitals. So, yeah, Ted just kind of gave me an outline of what you might like to hear from our program. And first of all, just a basic crisis overview. In the past several years, lots of changes have come to mental health in general, but in particular crisis. So there didn't used to be kind of almost a separate crisis unit. We sort of developed that as things have gotten more intense. And I think it's no secret that, mental health is just on the front burner in the last several years as well. So we right now have a team of 4, soon to be 5. Ultimately, to be fully staffed, we would have 5 workers. And our duties are 24 hours a day crisis. So whether that call is coming in during business hours, in the middle of the night, on a weekend, we provide services, whether in person or on the phone during those 24 hours. We, of course, have to abide by Chapter 51 statutes. That's how we run our program. That would be the legal things that say this qualifies for that emergency detention or this does not. Who actually is a candidate for a hospitalization or even eventually a commitment, as well as DHS 34, which essentially tells us how to run our program and how many hours a day we should be mobile, things like that. We also, just to mention real quick, too, after hours, we also cover for our APS as well. So we do get occasionally, not many, but some of those calls and feel some of that as well, which obviously will turn into, a referral to their program.
And
that's
APS is Adult Protective Services.
Yes. So we, like I said, probably, I think it was about 4 years ago now, switched to the version of no longer just doing it over the phone, trying to be in person and present as much as we can. That's been a pretty healthy way of doing that. It's better relationships with the hospital staff, better relationships with officers. Because I think we were turning in, why are you making this decision? You're not here. And now we're living in the world of COVID. So we've backed off on that a little bit and just try to make our best judgment calls possible. We really ask directly to the officers, do you want me to come? Or to the hospital staff, does it make sense for us to come? But still trying to be there and be as present as we can when we make those decisions. So the purpose, of course, of all of this is to help somebody going through a crisis. And though we are technically mental health crisis looks different to everybody. So a lot of times after hours, we're fielding those calls that it might be a transportation crisis, it might be a crisis for housing, somebody doesn't have a place to stay that night, it may be a domestic type of a crisis. So definitely not just hospital-driven calls. And I try to do, each month you guys get the statistics, I believe, that I put together. And there's probably some information that doesn't make a lot of sense on there, but I do try to even out like the calls that we say are non-mental health crisis calls. And what that just means is that when they called us, there was no intention that this person was having a mental health crisis and we're looking for a hospitalization. It was more of the, somebody doesn't have a place to go tonight, or we're calling to report this for whatever reason, we just want you to follow up. But obviously, the purpose is to work through those crises. So to get back to basics, mental health crisis, somebody's in a mental health crisis, feeling like harming themselves, feeling like hurting somebody else. We work with that person and whoever might be with them, as well as the professionals with them. We work, least restrictive to most restrictive, which means anything from how can we walk out of this situation and know that you are safe? Does that mean that we sit down with a piece of paper and we truly just make a basic safety plan? Here are the numbers of people you can call. Here are those crisis numbers you can call if you just need to talk. These are the things that help me get through the night when I'm not having a good night. I listen to music, I take a walk. And then we always do follow up as well on those. The next day, do you need to be hooked up with some services? Are you, interested in seeing a therapist? Things like that. And then the levels kind of go from there. So the next level might be finding someplace for them to stay, whether that's a friend, a relative. We also have Gateway available to us. So we are able to make those referrals after hours as well. And then of course hospitalizations. And most of the time we have the opportunity to either do that voluntary or involuntary. The involuntary is what we refer to as that emergency detention. That's always our most restrictive. We try not to do that if we really can find any other alternative. As far as just examples of how we engage with our clients, so normally a call will come in from either law enforcement, an emergency room, a clinic, the family, and we go from there. We may, like I mentioned before, we may see them mobilely, we may go out to the emergency room, out to their home, or just work with them over the phone. Sometimes we just want to set up a meeting to see us the next day. So that varies. More often than not, pre-COVID, if we got that call between 8 a.m. and 8 p.m. on a weekday, we would go. No question about it. We were going out to, like I said, their home, the hospital, the schools. So, some struggles, I would ask the reasons. So, and I can expand on this if you want, but just real briefly. Struggles include the things like just falling through the cracks. And what I mean by that is people that we know are struggling, people that we know have mental health issues, we know they need help, but they're also not meeting our legal criteria. And it's really voluntary as a competent adult until you are a danger to yourself or others. And that was a really difficult conversation to have with family members who are looking for help. So that's always that's probably one of the more difficult parts, I think, of my job, is just explaining that I cannot force them into treatment until we meet that level. And that as a family member was very scary. Living in a rural community, transportation tends to be an issue, especially at night. So maybe somebody wants to go to the hospital voluntarily, but they don't have a ride there. Again, just going mobile has been more difficult for us. We're trying to avoid that as much as possible if it makes sense. Again, because we live in a rural community, housing. So we do get a lot of calls that people are in crisis because of housing, and believe it or not, that will lead right up to suicidal ideation. You know, if I know I'm getting stuck in my place, I don't have a place to go tomorrow. I've gotten to the level where I want to hurt myself. So working with those folks, and then really just, you know, as far as the program goes and successes, as many struggles as we have, I mean, our successes are also just numerous. There aren't a lot of people that we work with that at the end of the day you feel defeated. So there's always going to be difficult situations and go through really tough times. And I mean, one person that I can think of offhand is just, you know, somebody that I worked with for months and months, and we're hitting all sorts of it. We're hitting the mental health part of it, and you know, maybe the juvenile part of it, and parenting issues. And finally, after so many contacts and after so many, you know, just kind of just sticking with it and not giving up on it, being able, all of our successes are really just because of our referrals. So being able to work with CCS, being able to refer to, you know, CSP if it's an adult, a chronically mentally ill adult, being able to refer to the ADRC for some extra help for either elderly or disabled folks. So at the end of the day, I mean, obviously, if we didn't have that, you know, same with all of our therapists and our doctors that are right here in-house for us, it's a game changer. It's really a lifesaver compared to trying to get into psychiatry in the private sector, can sometimes take months. And we don't have months to wait, you know, so very thankful that we have that opportunity here. So is that in a nutshell, very much a nutshell, but I know there was a lot of areas there, but any specific questions? Yeah.
I was in a meeting some time ago. In places where we have a catastrophe and you have to take him into a hospital and he needs to be committed, where do you take them? They don't take them over here at Waupaca.
So if somebody needs to be hospitalized, they always have to go through medical clearance. So we're encouraged by all the psychiatric hospitals to do that at the closest location, because our psychiatric hospitals will not admit until that medical clearance is done, which sometimes takes hours. And they don't want to commit to that admission. And now we have somebody down in Appleton, and it turns out they actually need to go to Green Bay or something like that. So we always start at usually the Waupaca or the New London Hospital, and then they go through their medical clearance, and then we make a referral to, we try to line it up with their insurance, and or, you know, have they been someplace before, had a good experience, and would prefer that hospital over a different one. So that's how, and then they get transferred. So if it's an emergency detention, the police would transfer them, sometimes an ambulance with police officers. So,
But what they were telling us that you don't usually go and sit with the person, do you? It's always the officer that goes and sits.
Yes. So if we respond mobily, obviously we're there for a period of time, but we do not sit with them for the duration. They are considered, once that detention is placed, they are considered in custody, and it's the officers that have them in custody. So yes, they sit with them.
And that's why our police, sheriffs, are upset because we can't give these people placed in a timely manner. It takes them off the streets and on their duty by sitting for hours in the hospital.
Yep. No, that's a very common complaint. We are well aware of it. 100% out of our control, because a medical clearance can take an hour and a half on a good night, and it can take 5 hours the next time. Or we may have a situation where somebody is medically unstable due to an attempt to harm themselves. So let's say an overdose of medications. That can take days sometimes. And yeah, then we're in that difficult situation legally where this person is technically in custody. They are not allowed to leave at this point. So somebody needs to be there and serving them in the event that they would try to leave and wouldn't be safe.
You could just put it in jail.
Jail is not appropriate for mentally ill, particularly in places where they're not safe.
Thank you.
Any other questions or comments for Heather? Heather, I just have one, and that is you touched a couple of times on people without places to go some night. Are you finding that that number has risen considerably during this pandemic we're having, or?
No, in fact, we talked a little bit about this last week, of what do our numbers look like in relation to the pandemic. I can't say that there's been an increase due to it, maybe a few situations in relation to it. As far as housing, I haven't had anything that would be directly related to that, though.
Thank you.
So if you guys see them for like depression or something that night and you want to get them in, but, because I've called, the hospital, the psych hospital, and they're like, well, we don't feel it's appropriate for admission, that we've ever admitted them. So then I have them, but can they get in faster if they go through the county to get into therapy or to see your psychiatrist? Because like you said, it's a 2-month wait.
Yeah.
For me to plug them in as an outpatient, a lot of times, unless they're gonna hurt themselves. So,
I think it depends. So, there's plenty of times as well that somebody may want to go to the hospital and the hospital denies them because they feel they don't meet the criteria. So then, of course, we work more with that referral of what next, what can we do on an outpatient basis. As far as getting into the hospital and us being involved, that normally wouldn't change anything unless, of course, it rose to the level that they, needed to because of the emergency. As far as referral though, we do take insurances. There are certain insurance, and I couldn't tell you which ones they are, and I think that they change often. It's the insurance world. Which ones are covered, which ones have co-pays, whatnot. And then if they do not have insurance, it's the sliding scale. So more often than not, we work with the person to try to figure that out, because again, it's in everybody's best interest for them to not sit and wait 2 months, 3 months, what have you, before getting help.
and if they call another department, that department will transfer it to you. Like if they call the ABRC center, somebody who's got a housing issue or somebody who's having other issues that needs a plug in, they call the wrong department.
Yes. Yeah, that should be possible. It's usually we've gotten really good with warm transfers with our phone. So making sure somebody's on the other line to pick that up, or saying I'll have that person call you back. But we have a calendar of certain people who are on call every day. So tomorrow, for example, is my day. So I am reachable all day. Whether that's email, phone, literally somebody tracking me down. I cannot hide. So I am available. So they make sure that that connection is made.
Anyone else? Well, Heather, thank you very much for coming and filling us in on what you and your department are doing and the challenges you have, and thank you for your efforts.
Thank you.
Heather does a wonderful job, and she maintains this bubbly personality. I don't know how, but she does.
Okay, next on our agenda, we have resolution number 30. It is a donation of $4,000 from the Community Foundation of Fox River Valley region for the purpose of supporting the Waupaca County Nutrition Program. Is there a motion to accept, Jan?
I'll make the motion.
Second by Dave. Any discussion? Hearing none, those in favor of accepting this donation signify by saying aye.
Aye.
And it has been accepted. There's a signature on the second page. Dennis, if you want to start that around. Then we have another donation. It's always a nice part of the evening when we can accept the donations. But anyway, the Waupaca County has received a donation in the amount of $5,000 from Premier Community Bank for the purpose of supporting the Waupaca County Nutrition Program. With that in mind, is there a motion to accept that? Jan, second by Sue. Any discussion? No discussion? Those in favor signify by saying aye.
Aye.
And we will accept that donation. Thankfully. Okay, catch up here with my paperwork. Okay, the next nutrition program, Ted, I'm going to turn it over to you.
And I'm gonna defer that, Jerry, right to Melissa. You're gonna explain that much better than I can. I can say that what we were trying to do is to try and maneuver through and take care of all of the outstanding issues that we've had so far with this nutrition program.
Right, so the first recommendation from the Nutrition Advisory, started at the Nutrition Advisory Council, was brought to the Committee on Aging and is now being brought forward to this body. The recommendation is to continue into 2021 with our 3-month contracts that we have with our caterers. The reason for that is the same reason that we've been doing the 3-month contracts up until this point. There's a lot of instability with food prices right now. There's a lot of instability with everything having, living through the pandemic right now. The 3-month contract allows the caterers, if things unexpectedly go awry, it allows the caterers to work with us in a partnership to adjust as we need to. Thankfully, since we've been doing these 3-month contracts, though, just so everyone knows, we have not changed any of the meal cost rates, or we haven't needed to change anything. Thankfully, I hope that continues. But that is what we're looking for 2021.
Any questions? Ted, do we need a motion on that?
Yes, please.
Okay.
Then I'll make the motion.
Jan makes the motion to continue to 2021. And Dennis second. Now any further discussion? Hearing none. Those in favor signify by saying aye. And it has passed. Then, Melissa, I would imagine you'll continue on with about the congregate dining sites.
Yes. So the second recommendation that is being brought forward tonight is specific to the congregate dining in at our Clintonville location, New London location, and Waupaca location. As you recall, June 2019, when we first started these discussions about the budget, that night that 3 options were proposed to this body, and the last option was chosen as the transitioning all of our traditional sites to the voucher model. Since that time, we know from talking with the state, they are not going to approve, nor do they recommend transitioning all of our sites to this new model. They strongly recommend a blend of the two models of the voucher program in addition to the traditional congregate sites. We've got 3 sites that consistently perform well, and when I say that, I mean they have consistent participation of 10 to 25 people a day. This is something that we've very closely monitored for years now, and we have documented so that we can see exactly where we're at these 3 sites. The 3 sites that I mentioned, Clintonville, New London, and Waupaca, are the sites that we are definitely using the most. The other locations have participation between 3 to 6 people a day. That's an average, of course. So the other sites, and we had talked about those last month, that those 3 sites would not reopen. So what I'm looking to do is, as it is right now, the direction that I have right now is to continue moving forward with the transition of all of our traditional sites to go to the voucher model. So our recommendation that I'm bringing forward to you today, like what Ted had said, is again, just kind of cleaning some stuff up, and asking through the recommendation that we continue to leave when it's safe to do so, Jed, when it's safe to do so, to continue with those traditional sites in Clintonville, New London, and Waupaca.
No, Melissa, these went through the 2 standing committees also.
They did. They went through. Yep. Yes. Sorry. The same as before. Nutrition Advisory Council and then through the Committee on Aging. Yes.
And they've approved that and asked that it
Yes.
be brought here.
Yes. Or
Approval.
yes. Yes. Correct.
I'll make a motion to accept that recommendation to keep traditional congregate dining sites open in the communities of New London, Waupaca, and Clintonville.
So second to that, Jody? Any further or any discussion on that motion? Jen?
Mr. Chairman, I would like to say something, please. This is Craig.
Okay, go right ahead.
Thank you. I think this is an excellent time to change from what we're doing and not reopening the congregate meals in the smaller communities because they haven't been able to get together. And this will be a good transition to having the 3 that we would like open to stay open, and the other ones won't necessarily resume. So I'm totally in favor of this proposition. Thank you.
Thank you, Supervisor Craig. Supervisor Larry?
Yes, I don't know if the board knows, but Melissa is the ADRC director now. And she has been doing a wonderful job with nutrition. She sent the letters out, she got some replies back. And so she's really carrying on very well. So thank you.
And I want to second that. I want to congratulate you.
Thank you.
Melissa,
Thank you.
and for moving this on so much faster in the last couple months. And I think all our volunteers and our congregate sites are going to be happy to hear this so that they're not in limbo anymore.
Right.
And so I thank you for doing that.
My pleasure.
Anyone else?
So if you're on the voucher system, is it gonna be by location? Maybe request that? So someone from Waupaca can't request it in this area, so it'll be by address or?
They can. As long as you're 60 years of age or older, anyone can request a voucher. The vouchers are not given per service area. However, I will say the first area that we're going to be targeting and letting them know that we have the voucher model open and approved in Manoa are going to be those folks in the Manoa area that have attended the site before that have not had a traditional congregate site for a year now.
Did we finalize the restaurants like in Marion and?
What Jan was referring to is we're starting one community at a time. The next community, so we have Manoa set. We're working with the Manoa Steakhouse. We're working on that menu. We're working on tightening and buttoning up everything so that when we're ready to open and things are safe to do so, we've got everything in place at the Manoa Steakhouse and we can invite people in. The next community that we're going to be doing the same thing to is the Iowa Scandinavia community. So what I did is I mailed letters to all of the restaurants with the help of our sanitarians that are licensed and approved and are meeting our Wisconsin food code. I sent letters to them just explaining that we have this great program, this great opportunity, and if they want to learn more about it, I didn't bore them with the details in the letter, but to contact me if they wanted to learn more. And there are just today, so the letter went out just a few days ago, and I've already gotten 2 restaurants that would like to meet with me. So that's pretty exciting.
Anyone else? Well, I just want to say that, well, we got a motion. Is any further discussion on the motion? About the 3 congregate sites? Hearing no further discussion, those in favor signify by saying aye.
I,
Opposed? Okay, I just want to say that we are very fortunate that we have Melissa moved into this position. She's done a wonderful job as assistant or whatever her title was before. She knows the ins and outs. And it was such a nice thing that when you applied and we were able to offer you that position and you accepted it.
It's only been a week since it's been official, but I'm enjoying it, that's for sure. Yeah. It's been good. Nice to get some stuff done. So, yeah.
Thanks, Melissa.
Thank you.
Okay. In your packet was the advisory committee reports and updates of the Nutrition Advisory Council minutes from their meeting of October 22nd and the Committee on Aging minutes from their meeting of October 27th. Any comments on any of those minutes? Okay. Moving on. Then we come to the monthly unit updates. If you've had a chance to go through those, you month after month, you realize all of the different activities, the different efforts, and in some cases, how full the plates are of some of these different areas on second floor. But everybody seems to be pulling together well and attempting to do the best they possibly can for our clients, the citizens of Waupaca County. Now, somebody had their hand up before I started jibber-jabbering.
Cancel.
You want?
Cancel.
Oh, cancel, okay. Any discussion or comments on those updates? Okay, then we have the board meeting schedule. You've had a chance to look at those dates. Starting on January 6th and going through December 1st. I think Ted is putting this together. I think he said something about December 1st, 2021, he'd bring Christmas cookies, but I'm not sure.
You don't want me to make them, but I certainly can.
I'm not sure I heard that correctly.
I was thinking hot toddies or something.
Hot toddies. Hot time in the old town tonight, huh?
That's right.
Okay.
Be a longer
Any
meeting though.
comments on the dates? Okay. The next was the, under finance, income statement overview.
We do have Erica on Zoom. Erica is now out for her 3rd time of being quarantined due to having a close contact with someone who someone who did test positive for COVID. And so we're going to see if she can do 4 or 5 times by the time this is over.
Oh, no, don't say that. Can you hear me okay?
Yes.
Okay, good. I don't even go anywhere other than work. Apparently, I just need to stop coming into the office completely. Okay, so I will just keep this very brief. Looking at the income statement here, I'm a numbers gal, so I'm a little bit of a nerd, and I get excited when I see patterns. And you'll notice our target percentage for revenue is 63%, and for expenses it's 75%. But if you look at the actuals, those two numbers are flipped. So we have the same percentage numbers, just flipped between our revenue and expenses. last month when I brought the income statement, I had mentioned to the group that we did not have our tax levy contribution included. That is included now on this September statement, so you will see that. The bottom line right now shows us at a little over 1.8 million to the good. That's not uncommon for this time of year, particularly when you talk about the tax levy portion showing up. That is 22% of all of our revenues. So it's not like it's an even distribution, throughout the year. I will expect that our revenues will be tapering off. We won't be seeing as much in revenues coming through through this fourth quarter here. One other note, I know we've talked about it. We've mentioned that our billable revenues are down. I would say when I'm looking at those numbers, a generalization is that possibly close to 2 months worth of revenues that we've lost as a result of COVID and how that's impacted the billable time that we can capture for folks. Otherwise, it's a tough year, but the trend looks good again, that our revenues are coming in higher than we are hoping for, and expenses coming in lower. Are there any questions? Oh, I'll just make note too, of our grant funds, we have claimed 75% right now of our grant funds through that September report. Are there any questions for me on the income statement?
No questions?
Erica took care of my questions the other day. So.
Okay.
We had a lovely chat.
Yes. Thanks, Erica.
Well, Erica, I haven't seen you in a few days. All I can say after hearing from Ted about the numerous quarantines, as your mother would say when you were a little girl, you're hanging out with the wrong crowd.
I know, right? Ted will have to show you the picture. I'm buying myself a birthday present. It was my birthday yesterday, and I'm buying myself a big bubble to put myself in when I come into the office.
Well, that should be interesting to see that.
Well, navigating the doorways might be tricky.
Okay,
Happy
well,
birthday.
happy
Thank you.
Birthday.
and stay well. Okay, we have a couple of payment registers here, one from September and one from October. If you've had a chance to peruse through those and have any questions, now is the time to ask those questions. Seeing no inclination to ask questions about this, we'll make a motion on both of them at once, the September and the October payment register. Is there a motion to accept those? Dave Johnson, there's second, Dennis. Any further discussion? Hearing none, those in favor of accepting the two payment registers signify by saying aye.
Aye.
And they have been accepted. There needs to be signatures on both of them as they come around. Sorry, Dennis, you get it over the part about that. Okay, personnel. Ted?
You do have, in your packet, a spreadsheet that Liz puts together that indicates the resignations and the hires that have occurred since the last meeting. We are pretty active in our recruitment and hiring. I do think that it does appear that, the wave that we saw of resignations and those things has subsided, and now we're really just dealing with typical life type experiences. We do have two manager positions that we'll be interviewing for over the next 2 weeks. And as has been announced, Melissa is our new ADU manager, and she's doing a wonderful job. We're really happy that she decided to apply and accept. But we are doing, I think, pretty good. I don't think that we have a lot of use the word crisis, and not in Heather's sense, but we do have, I think, the crisis part of people leaving, and they're pretty pretty much over at this point. All we have to do now is make sure that we keep Jed. We try to keep him healthy and those things, although he is looking for his opportunity to be quarantined so he can get a day off.
Hang out with Erica for a while.
Yeah, that's right. Yeah, that's all you gotta do, and you can be out, you can have a whole bunch of days off.
Okay. Yeah, as far as the resignations and the changes in that, today at finance, Mandy from HR made her presentation and it was amazing. She said, October, there were no resignations. And I can't remember in 16 years, they were having a month go by where there wasn't any resignations. So things, hopefully it's stabilized and people are satisfied with their positions and
We hope,
yeah.
trying.
Okay, moving on, the director's report.
This month, what I started doing is providing and writing a brief overview of things. I'll continue to do that. There are a couple of things that are not in that report, and this just came in the last day or two. And I guess I just want to give a shout out to Shauna over here for just a wonderful job of with our community partners, and also Kristen. Kristen is, I don't think Kristen's here. Kristen as well, working very hard on that. I'm going to read two statements that I received via email from the Waupaca School District Superintendent. And he got this from his staff. And the first one relates to the work Kristen is doing. And it says, the experiences I have had calling in a CPS report have been positive this school year. I assisted the teacher in making a CPS report last month. She was concerned about how she would be treated when she called due to past experiences. After the call, she said, that was the nicest I've ever been treated calling them. The CPS intake process has definitely improved. And that's a direct result, I think, of Kristen and her desire to really bring the A game into that service area. She's doing a great job. She is just a hardworking young lady. The next one, this is, thank you, Shauna, for this. It says, I haven't had any contact with CPS yet this year. However, have had contact with CST and CLTS coordination and services. The contact and coordination of services was efficient, friendly, and helpful. Can't say this has always been the case over my past 10 years working in Waupaca County with families that need resources or are struggling. I'm looking forward to more positive interactions with Waupaca County as time goes on. So again, direct result of Shauna and her staff really working to build the relationships with our community partners. Thanks, Shauna. Outside of that, sir, I have nothing.
Jan?
Ted, I was at the CCS and CST meeting last week Friday, and I have to say that was probably the first meeting that was so organized and carried out by Shauna. So thank you, Shauna. And she's got a request because we talked about it, so she's going to talk to you about it.
Okay, moving on to board members' reports of meetings attended and general correspondence. We haven't seen Jan.
Yeah, I think Sue and I both were on Zoom with the state for the county board program. And when I dealt with the ADRC meeting, the county ADRC, I really have to say I learned a lot. Just to summarize, we have 72 counties and 70 counties with 11 tribes are in the ADRC program. And they brought up the home delivered meals, the congregate dining, nutrition programs, caregiver support, Alzheimer's Coalition developed in Wisconsin now by Russ Feingold, benefits specialists, advocacy program, and transportation. And it's all these things that the ADRC has to deal with. And they also, Sue chime in because I just summarized. They also warned us that we, county boards, need to be aware of it because funding in 2021 is still going to be stable. 2022 and 23 will not. And therefore, they're asking for some federal guidance to increase it, state guidance. But if they don't get it, then we're going to have to levy for the program or cut some of the program. That's what they mentioned. So we need to be aware of it. And it's a program that's needed because the population is going to be increasing. So, do you have anything else?
No, well, yeah, the seniors are growing and the funding is not. So we're gonna have some big decisions to make in the upcoming years.
Thank you for that brief report on what you listened to. That was by Zoom.
Yes, and the speaker really laid it out well, you know, like step by step. But, and also gave me some points to bring up at our nutrition and aging meeting also. Because one of the biggest things in this ADRC right now is loneliness and isolation. And how do you deal with that?
It's a problem.
It is.
Okay,
And some of
any
the
other-
COVID stuff, for me, I'm wondering if it wasn't because of isolation and I can't even remember what I said, loneliness. They leave themselves go and then catch a bug and they're dead.
I don't
So,
know, I think our health professionals would know what effect on the human body and the immune system and everything loneliness and isolation might have. I don't know.
mental health issues
Yeah.
also.
So,
Anyway, it was a very good program. So.
any other reports by anyone that they went to a program or listened to a program? Okay, hearing none. Moving on to adjournment. Motion to adjourn. Jan, is there a second? Sue? Those in favor of adjournment signify by saying aye.
Aye.
Thank you. Ted,
Pat, it's good to have you back.
what's that?
It's
Oh,
good to have Pat back. He's been gone.
Ted,
No, I'm here. Thank you, Jan.
What?
Thank you.
Yep, you're welcome.
I owe Jerry a six-pack of